So the school clinic is a program by the federal government that puts clinics in schools that serves our community.
The students can come in and be seen for any acute condition for the most part. We do flu tests, we do strep tests, we can treat pink eye.
They go in depth more with diagnosing and treating rather than just a school nurse.
The student comes into the school nurse and they do not have a fever, but they're not feeling 100%. The school nurse can touch base with me. We have consent on file. I reach out to the parent. We schedule an appointment.
What's nice about the school clinic is that I can now prescribe those medications to treat those problems. So if it's pink eye, I can send eye drops, ear infection, antibiotics. In the case of flu, we could send Tamiflu, that kind of thing.
It's very convenient for parents, so they don't have to take off work to go get a strep test done when we can do it in the teen clinic. And then if something is larger than what we can do, we just say, we'll put in the orders and they could go to one of the main clinics to have further testing, such as blood work or an x-ray completed.
The other nice thing is because of the way we use Freesia for our check-ins with NorthShore, the parent does not have to be present.
She's always has acute openings, and with my busy work schedule and sports with the kids, it's hard to find balance to just take off work and get to those appointments quickly.
We have equipment in all of the schools that allow the nurse practitioner and the school nurse to work together, where there's a stethoscope they can place on the child's chest where I can hear the heartbeat, the lung sounds. They have an otoscope that I see when the nurse puts it in the ear. We have extra lenses where we can see the skin up close, see the eyes. So that allows me to interact with them. I can see them, treat them, send the meds, and then get the kids home to feeling better.
It's actually been really nice to know that I can send my kids to school with something acute that they don't necessarily need to leave school for, but that Sean is able to see them during the day, pull them out of class briefly, and then send them back to school as long as it's not something that they need to be home for. That's been really beneficial as a working mom with multiple children.
We could do sports physicals. It's very convenient for parents to make an appointment.
A lot of students here don't really have transportation, me being one of them. And they'll be like, hey, this day we're doing this type of physical here. The fact that they're able to help out with that and make it to where you don't have to just go to NorthShore, they can work through the school. It makes it easier.
The wonderful thing about school-based health clinic is we want to make sure every student is able to be seen. If the student has Medicaid or insurance, we will bill the insurance first. If there's anything remaining, that cost is not put onto the student. So if there's a copay, they will not receive a bill for that copay. If they have no insurance, we have a sliding scale available, and there's other programs in place for students to be seen. Our sports players, a lot of them are like, oh, I'm nervous, I have to get $20 to pay for the sports physicals. NorthShore helps make sure they don't ever have to worry about that. We would never turn a student away because they could not afford the visit.
For anybody that might be hesitant about coming here, I just highly recommend the ease to get in. I mean, it's just a great option, especially time constraints and inability to get there, just scheduling it all together. It's easier to get in here. I've heard that from many parents.
I think the school clinic is great because she can really assess them. There's no judgment when you're here. It helps the parents, I think, feel comfortable because she becomes your friend too. She remembers their names, she remembers their sports and their activities. Kids feel really comfortable coming to her.